We are going to discuss Chapter 14, Communication with Patients and Coworkers. Most communication between the sender and the receiver is nonverbal and must be interpreted correctly. Verbal and nonverbal communication must be congruent for a clear message to be presented and interpreted. Upon completion of this lesson, you will gain knowledge that is related to course objectives 2 and 4, and then the following lesson objectives will include: for you to be able to describe principles of communication, recognize and apply therapeutic communication, be able to respect cultural diversity, and be able to discuss delegation in terms of effective communication. So what is therapeutic communication? It is how a nurse engages in a helping relationship with the patient and family. So it's not only important what we communicate, but it is important how we communicate. Requirements include empathy, which is the ability to perceive the patient's needs, feelings, and situation accurately, but not sympathy. It's genuineness, ability to meet person to person in a therapeutic relationship. It's a positive regard, which implies respect and a willingness to work with the patient and communicate through actions that the patient is worthy of caring for. It's also self-awareness. That's the recognition of one's own feelings. And it is non-judgmental. You have to suspend your value judgments. Therapeutic communication requires empathy for and an understanding of the patient's feelings of fear and helplessness. Hospitalizations are stressful, and the nurse must suspend value judgments and not take negative patient behavior personally. So, as the RN, there are key things you need to do. First, use warmth, acceptance, friendliness, openness, empathy, and respect in all interactions. Certain factors such as friendliness, touch, and humor enhance communication between the nurse and patient, as long as it is appropriate humor. Provide for privacy, confidentiality, and comfort of the patient. As stated before, appropriate humor and touch can help foster a closer nurse-patient relationship. Always ask permission before touching a patient. And actively listen to your patients. Effective active listening requires the nurse to concentrate fully on what the patient is saying and to clarify the message with open-ended questions. Okay, so let's look at the taboo things, what not to do. Some communication blockers are where someone tends to stop conversation, and this builds mistrust. So we have condescending language, questioning a patient's reasons rather than accepting them, using why questions, being a task-oriented approach in your nursing care, referring to a patient as a room or bed number, failing to listen attentively, offering unsolicited advice or false reassurances, such as, "Oh, you're going to be okay," using cliches, or engaging in gossip. Patients hesitate to communicate with nurses who are condescending and abrupt. Patients should be able to reveal personal information to the nurse without being judged. Now we're going to talk about the nurse-patient relationship. What is the nurse-patient relationship? Well, it has been defined as a planned and goal-directed process that focuses on the patient's feelings, problems, and needs. It is not a social or intimate relationship. The nurse-patient relationship is a therapeutic partnership that is goal-oriented. There are 3 phases in the nurse-patient relationship. We're going to start with the orientation or the introductory phase. This begins with the initiation of the nurse-patient relationship. It begins with the development of a trusting relationship with the patient. It includes introductions and goal setting. It orients the patient to the facility, the unit, the room, and the healthcare team. In the first or orientation phase of the therapeutic relationship between the patient and the healthcare team, introductions are made, goals are addressed, and trust is developed. Our next phase, or the second phase, is the working phase. This is the longest phase. It begins with the nursing assessment, the interview, and the physical examination and continues until the relationship is terminated. You have to have understanding of the patient's story. You have to use opening questions. You have to be positive when using interviewing techniques. You want to include the family. You want to have awareness of the patient's current condition, altering assessment, review the interview, and provide an exam as needed. Interactions deliberately planned, implemented, and evaluated in concert with the patient to reach mutually agreed on goals. During the working phase, the longest phase, the nurse-patient relationship involves assessments, cultural considerations, effective listening and communication, and mutual respect and cooperation. And the third phase for the nurse-patient relationship is the termination phase. This is the final phase when the nurse-patient relationship is completed. It needs sufficient planning, time to review goals and outcomes, and patient teaching. Patients need support because they may feel a safety net is being lost. Some patients actually fear going home sometimes after being in the hospital for a while. The nurse-patient relationship may be completed for several reasons, but in all cases, a review of goals and the arrangement for patient education are important to prepare the patient for the next step in the patient's recovery or care. Now I want to discuss health literacy and cultural competence. Health literacy involves an individual's cognitive, social, motivational, and ability to gain access to and understand and use information to promote or maintain their health. It's affected by education, culture, society, and the health system itself. Patients may have low health literacy skills. They may have problems reading, comprehending, errors, or confusions. Strategies are to speak slowly, be specific and concrete rather than general, avoid jargon and medical terminology, reinforce information, have the use of the teach back technique, and then use easy to read or visual materials. Among patients, there are levels of healthcare literacy which are affected by education, culture, and society. Patients with low literacy skills have the most trouble navigating the system because of the complicated rules, the medical jargon, and the lack of patient teaching. Clear communication and visual aids can assist these patients to understand how to access and use health information. Understanding the patient's perspective and acceptance of healthcare practices through the view of culture is a challenge. The assistance of interpreters in the investigation into the practices of cultures in the nurse's surrounding area can be a great help in promoting health literacy. Well, let's talk about older adults. Do you think this can be a concern with communication? Older adults need special accommodation for changes in hearing and vision. Physical challenges, psychological factors such as depression or poor self-concept, mood, attitude, and loss of control. Some of the strategies include to adjust the pace of the instructions and provide extra time. Minimize distractions and repeat the information. Avoid use of abstract terms and negative messages. Provide adequate light. Avoid blue, green, or violet ink. Use a lower pitched voice. Eliminate background noise. Provide a paper and pencil and have the patient restate the message. So let's recap. Communicating with older patients may present a challenge because of hearing and vision changes. The nurse should consider how illness reduces the cognitive function and consequently adjust the pace of the instruction to improve the clarity of the communication. So, now what is collaborative communication? Well, this is the process of passing information to healthcare team members. Think about using the S-bar. Remember, it is situation, background, assessment, and recommendation. It is useful for emergency patient situation and handoffs. First, you will state the issue, which equals the situation. Describe the background. State the problems. This is part of the assessment. And make recommendations. So here are a few thoughts. Communication skills are imperative, not only between nurses and patients, but also between nurses and other healthcare professionals. Generational issues can be an issue when several generations having different and unique views, work ethics, and communication styles are all part of a healthcare team. Communication styles, for example, aggressive, assertive, or passive-aggressive, can actually complicate effective communication. The DESC and the S-bar methods can be employed to enhance communication. Okay, now we're going to briefly review the RN as a care manager when it comes to communication and delegation. These are two diagrams distinguishing the assessment and procedure for delegation, and then the other one is how to effectively communicate when it comes to delegation. Delegation, that's a transfer of authority to a competent individual to complete certain nursing tasks. The individual must be qualified and must have demonstrated competent ability to carry out the task. The task can be delegated if it is within the scope of practice of the person to whom it is being assigned to. RNs cannot delegate an assessment, nor planning, nor evaluation, nor nursing judgment. The RNs do retain the accountability even if they delegate. Remember the 5 rights: the right task, the right circumstances, the right person, the right direction or communication, the right supervision or evaluation, and newly added right documentation. So to sum it up, the RN must delegate patient care to competent, qualified staff members who are able to perform the task within their scope of practice. The RN must be assertive and clear while being fair but firm. Well, this image could look a little discouraging. Let's discuss nurses and doctors and the nurse-physician relationship when it comes to communication. The nurse-physician relationship is an effective collaboration that creates effective teams and improves the work environment. There have been problems that are identified by nurses. For example, inappropriateness, disruptiveness, or abusive behavior, dismissive attitudes, and belittling or intimidating behaviors by physicians. The Joint Commission has called for zero tolerance of abusive physicians. It was found that failure to communicate among healthcare professionals caused 70% of 2,455 reported sentinel events. So common conflicts resulted in quality of care, treatment decisions, family involvement, quality of parental care, staff inconsistency, nurse assignments, nurse-physician issues, ways to soothe hurt feelings. You need to slow down and listen, acknowledge anger, empathize, don't make promises you cannot keep, support your coworkers, and refocus on something positive. And thank them for bringing the problem to your attention. So basically, to recap, one of the most problematic collaborative relationships is the nurse-physician relationship that can greatly affect patient care. Differences in approaches to healthcare can cause communication breakdown. Nurses can be empowered to be competent communicators by providing accurate clinical information, staying abreast of the most current advances in healthcare, and joining committees and professional organizations. There are multiple resources that you have available to assist. There are pastoral care, charge nurse, nursing supervisor, security, medical social worker, case managers, ethicists, and many other resources that have not been mentioned here. As we go through the next few slides, I want you to think about the scenarios that will be presented. You are floating to a different floor that you are not too comfortable with. After report, you start making rounds on your patients and doing assessments. You place a call to the physician because you are worried about a patient. When the physician calls back, he berates you for calling him in the first place and says that any med-surg nurse would know that. You hang up the phone, shaken, and even more unsure of working on this unit. What would you do? Or what about this one? You are an ICU nurse and the patient's wife brings in the power of attorney or living will for your brain dead patient. She announces that her husband would not want to live this way and she wants to take him off life support. Her in-laws are in the waiting room when she tells them her plan. They start yelling at their daughter-in-law, saying that she never loved their son and now is trying to kill him. What are you going to do? How about communication with parents? You are working in the pediatric ICU and a code blue is called. It's not your patient, but you go into the room to help your coworkers. You notice the child's parents have been pushed up against the wall in the corner of the room all alone and are becoming upset as the code team works to revive their child. What can you do in this situation? Or how about angry coworkers? It's been a crazy shift and you are rapidly trying to make shift assignments before the next shift arrives. Someone has to float and all of the nurses have been floating lately. You choose the one whose turn it is. When that nurse sees the assignment to float, they stomp off and refuse to go. What would you do? And how about a nurse-patient conflict? You are at the beginning of your shift in an ICU and enter the patient's room to complete your assessment. You had this patient the night before, so you've met the family. When you enter the room, a family member rises up and starts complaining about the day shift nurse and how she wouldn't allow the patient's siblings to visit and wouldn't let them hold their child all day. They want to fire that nurse from ever taking care of their baby again. What do you do? These are dilemmas or situations that as an RN you will encounter and have to proceed to take care of them. You do have resources to assist you in these matters. Effective communication will be a key component when you are faced with these dilemmas. Okay, let's move on to charting. What is charting? Charting is documentation as communication. You document in the chart. It's a legal record. It's used to measure outcomes and determine cost. It may serve to defend care given if litigation occurs. It establishes that standards of practice, policies, and procedures were followed and the standards of care were met. Must be an accurate accounting of the patient's responses to the illness and treatment. Remember, this is a state guideline. If it is not charted, then it was not done. Most common errors in charting include using a medical diagnosis rather than acceptable nursing language to communicate a patient condition, using broad terms instead of specific signs and symptoms, charting your own opinions, thoughts, and feelings, neglecting to record the patient's response to the intervention, or using vague or ambiguous terms such as worse and better. So here are a few charting tips. These are to help you reduce errors in charting. Use the nursing process to guide your charting. Consistently use standard language and approved abbreviations. Record the patient's exact words verbatim as much as possible using quotes. Be truthful and stick to facts. Chart patient response after treatments or medications or interventions. Use objective measures when possible. Use proper grammar and spelling and write legibly. Documentation must be factual, to the point, descriptive, relevant, accurate, clear, and precise. So to recap, ethical and legal integrity of clinical documentation is a factor the RN must consider when charting electronically or through email, and patient confidentiality should always be the highest priority. Avoid ambiguous language. Use precise verbiage, and when possible, use the patient's exact words in quotation marks. Documentation should be factual, unemotional, and objective. This concludes this lesson.